I don't have. Oh.
Hey, everybody, it's a daily dose of Dr. Drew, and here's Dr. Drew.
Hey, guys, how are you? Welcome. Hi, I see Hang Loose Mag. Interesting. So, thank you for joining me. Let me give you a couple minutes. Let this thing sort of scroll up here or spool up, whatever it might be. Is Periscope going, everybody?
Periscope is up.
Periscope is
I
up.
have the wrong date on there. I'm sorry, you guys, but
Today is the 8th, in case there was any question in all this.
Perfection is overrated.
What's my diagnosis of Joaquin Phoenix? I can't tell. It's something, but I can't tell. I did notice he had a fine tremor, and fine tremors, if you notice when he's smoking as the Joker, when they have real close-up on his hand, there'll be a very fine tremor. And that is usually a medication kind of type symptom. So interesting. Happy New Year. Thank you in Dallas. Thank you, everybody. Good morning. Good afternoon, many of you. So here we go. I'm ready to take your questions and scroll up. I'll just remind everybody, sign up at drdrew.tv so we can push out that blast on Sunday when we do the call-in show. That'll be around, Miss Producer, about 3 o'clock. Is that correct?
We should probably have a banner that goes up when you say that.
3 o'clock? Is that about right?
3 o'clock on Sunday, yes.
3 o'clock on Sunday is about what we're going to do.
Your guest is your daughter,
yes,
Paulina Pinsky.
She will be here. And the dogs will be here, too. We'll have to have them do an appearance. And also check out drdrew.com, the whole family of podcasts there. Me and Adam have a podcast most days. The Dr. Drew podcast, which is sort of more kind of an intellectual kind of a thing. And then You Live, #YouLive. This live podcast is more addiction recovery stuff. I
want to know about the New York Post article. Who did that?
I haven't read it. I did an article with the
Hill.
The Hill, and what I said to them, I haven't read the article, so I don't know what exactly was printed yet. What I said is that I do not want to run for political office, but that the disaster in the streets of Southern California is more than I can live with as a physician. So I wake up every day preoccupied about it, and I want those in positions of responsibility to please govern. And the absolute empty set, asleep at the wheel, makes me feel like I have to do something. And people were trying to get me to run for mayor. I don't want to run for mayor. And then people were swirling around saying, no, you should run for governor. And I'm not interested in that. I mean, and great news, everybody. Gavin Newsom, there's an article that just came out. Gavin Newsom is setting aside money. Hold your horses, everybody, for mental health services for the homeless, for wraparound services for the homeless, and sort of temporary sprung temp living environments. Still a little bit of rhetoric about housing, but actual services for people in psychiatric need. And he does go so far as to mention that allowing people to die of addiction in the street and psychotic illness is unacceptable. Governor Newsom, hats off to you. God bless you. I thank you for doing this. I don't care who gets on the right side of this. I'm with you when you do. So I have some relief since I had that article from The Hill that in California we're going to start to carve away at this a little bit, so I don't feel quite so mobilized as I did, say, even yesterday, where I was like, geez, I just found out I live in Adam Schiff's district, and we are dying out here. He seems to be doing no government. We need to have the IMD exclusion lifted immediately. We need to have a reconsideration of Lantern and Petra Short Act. We need infrastructure services desperately out here. What are you doing? Why are you worrying about your political life as opposed to the lives of the people you're representing? So that's what made me say I have to do something. Now, I don't want to. I especially don't want to in the near term. And that's all I said at the Hill. And now everyone's, the press that's going out is, oh, he's going to run for Schiff's position. Me. No.
Well, Scott Adams said you could win. So
Yes.
I wish he didn't say that.
You wish Scott didn't say that? Why? Because that kept me kind of in the game?
I mean, it's good for your ego, but
it's not good for my ego because then
we have to ask everybody to donate money, and we'll lose all our friends.
Yeah, that would be bad.
We need $1 million. Does everybody want to pitch in?
Okay, here's
it's
a long
lot
one.
of work to become a congressman.
Sex addiction is affect dysregulation. All right, thank you for yours. A huge thank you for activism. This is from Miha, I think, completing a master's in rehab counseling. Yes, that the sex addiction is affect dysregulation is the work of, oh my goodness, the head of the sex addiction program.
Could
Alex,
you read that question? Because
I can't, because it's scrolling away so fast, and it's a huge question.
Just scroll down.
It's essentially saying she's getting a master's in rehab counseling, and she's focusing on sex addiction as affect dysregulation. That's it. Alexander Katahakis wrote a book about that. It's an excellent book. I totally concur with that model. And that model, as it pertains to sex addiction treatment, will help you in treating other addictions as well, because it's all really ultimately a phenomenology of dysregulation. Dysregulation of the reward system, dysregulation of emotion, dysregulation of executive function. And it is in the interpersonal context that those problems are solved. So good for you. Alex, he worries about it.
That all went way over my head, but
okay.
Thank you.
Well, she knows what I'm talking about. Treatment for tendonitis, it depends where the tendonitis is, my friend. That's a bit of a loaded question. Is tendonitis in the hand? Is it tendonitis in the elbow? Is it in the shoulder? Jordan Peterson. What do I think of Jordan Peterson? I'm fascinated by Jordan Peterson. I found Jordan Peterson years before he became a lightning rod of the intellectual dark web. I am always looking for people that are integrating anthropology and psychology. And Jordan Peterson did that. He had the Maps of Meaning series. He had a whole lecture series probably now 5 years ago. And I found them fascinating, and I was interested in them, and I started listening to him back then. Then, all of a sudden, he took a position on the mandated speech around preferred gender pronouns by a particular district in Canada. He said he wasn't going to do it, and it made him a lightning rod of trouble on the college campuses, and then he started speaking about essentially his general philosophy. He's a good psychologist. He's had lots of experience, and he has a deep understanding of Jungian, let's call it anthropology, because it doesn't really have psychological merit these days, but it's meritorious in the sense that it is not it's not a fallacy. It has some real meat to it, and he's drawing sort of biblical narratives, Jungian philosophy, and psychology, and tying them all together. And he has some fascinating ideas, and he applies it in such a way that it helps people. He's essentially urging people to be the author of the narrative of their life. That's it. I would say that's the headline of what he is into. Bicep tendonitis, Jesse. Which proximal or distal? Is it in the shoulder or in the elbow? If it's in the elbow, well, in either case, don't get it injected, because it can weaken the tendon. It can rupture really easily. The most typical place for bicep tendonitis is that it goes under the acromioclavicular joint here, and it's rubbing, and physical therapy and ice and platelet-rich plasma, that kind of stuff can be very, very helpful. What is the difference between love and sex addiction? My goodness, that's a giant question. Susan, what did I say I was going to talk about today? I said I was going to talk about something yesterday, if you remember. Remember?
You're asking the wrong person.
At the end of the day, help me, you guys. I'm watching the scroll here on all the different platforms. You can help me. I should have
written it down.
I think I said I was going to talk about trauma and
trauma.
Trauma and dysregulation.
Thank
you. So here we go. It's a big, giant topic. So I'm not going to be looking at the screen at your comments just for a minute here, except to say that fundamentally we are born into the world awash in emotions. We have primary emotional states, disgust and hunger and discomfort and anger and that sort of thing. And we can't identify it, and we can't regulate it when we're born. We gain the capacity for regulation in an intersubjective context with another human being, typically the mom. That develops as a result of the mom attuning to the baby, listening emotionally like with their entire body. The baby's biological states regulating or sort of attuning to the mom, and the mom offering soothing affects to help regulate the baby. Also reflecting on the mom's face, very subtle changes in her musculature that are signals of what the content of the child's mind contains. Like when a child hurts himself, we go, we pretend. We don't catch the feeling. We reflect it on our face with a pretend state. It's called a second-order representation of the primary emotional state. That exchange of attunement, regulation, and second-order representation is how we develop emotional regulation. Now, in order to be in that context, it's deeply vulnerable, and you have to have lots of trust. If another person, particularly a caretaker, violates that trust, the child will leave that context and not go back. It's too vulnerable. It's too painful. They will never go back to that biological unit that allows us to build emotional regulation. Look up platelet-rich plasma, PRP, and you'll see for anti-inflammatory, it's very effective. Sorry, that caught my eye. So they exit the unit of intersubjective exchange and are never ever develop the capacity for emotional regulation. Now, what happens in the setting of trauma, and by trauma I mean neglect, physical abuse, sexual abuse, emotional abuse, is the child first goes into a fight or flight response as he or she tries to move away from the trauma. If the source of the trauma is a caretaker, it's a very conflicted state they get into where they're at once bonded to the trauma even more intensely because they're reaching out at the same time as they're pulling away. So they bond to the person and bond to the trauma. It's a very strange biology. And as that continues, it actually exceeds the child's regulatory capacity, and they flip from fight or flight into freeze, which is a parasympathetically mediated vagal nerve afferent phenomenon where information out of the body becomes somewhat disorganized. It hits the midbrain, and the brain cuts off from the experience. And it literally, as a result of repeated episodes, reduces the neuronal connections with certain parts of the brain. So the part of the brain that was experiencing the trauma literally gets walled off. So people that have been through trauma will often say, oh, I don't worry about that anymore. It doesn't bother me anymore. Yeah, not consciously. It's still there operating both in your body and in your brain. And in order to get that integrated back with the rest of you, and by the way, while it's there disintegrated from the rest of your neurological and mind functioning, it's there constantly asking for attention subconsciously, either with substances to feel better or traumatic reenactment. Humans do a very strange thing, which is because of that intensity, the bond of the traumatizing individual, something about it causes us to be attracted to people and places that are exactly like those original traumatizers. So then in our young adult life, we will start repeating the trauma over and over and over again. Psychologists will say we're trying to fix it. It's not really what's happening. It's just a biological wiring that makes us repeat it. So you're dysregulated. There are parts of the brains that are walled off. It's demanding attention. It's causing repetition compulsion. It is a deep pain that some people walk around with, that sometimes people use substances to medicate. And to heal, it's about returning to the frame of intersubjectivity with another human, which is why we in, say, 12-step have that basic model of the sponsor, where you sit with the sponsor and all that sponsor does is attune to you and listen and reflect back on their face appreciation of what's going on without interfering with your shame and guilt and whatever else you're expressing. And it's thousands of hours of that attunement that rebuilds our capacity for regulation. And it takes a lot of time because we're talking about building neurons and building neurological bridges back into certain regions of the brain. That is a slow process. Also helpful, EMDR, which is an eye movement therapy that can help people access those parts of the brains. Neurobiofeedback, sort of a click phenomenon. I can help them get back to that part of the brain. And also being with people who have been through these experiences, shared experiences, people who can say, yeah, I've been through that too, me too, I understand, has a level of efficiency of bringing people back together into that intersubjective frame from which they can build emotional regulation. So I told you yesterday that would take a while. I wasn't feeling up to doing that whole spiel yesterday, but there you go. And when I recommend things like emotionally focused therapy, I'm talking about intersubjective closeness again. That's why I sometimes will recommend that to people. And by the same token, Bert DeBrow, I'm on a streaming podcast right now. I'll have to call you back. Watch my stream. And I will also recommend sometimes specific EMDR or neurobiofeedback if they're having difficulty entering that frame and building the regulation, or if there's an urgency to it too. Hi, Maria from Europe. Dr. Jean's podcast. I don't know who Dr. Jean's is. Okay, thank you. Hope that was helpful. Joshua, and that's why you have anxiety. I'm not sure what you're getting through there. What if the trauma came from the birth as opposed to the caretaker? Yeah, when it's medically induced trauma, again, whatever the source, whatever the source, it still shatters the child's regulatory capacity and has to be rebuilt. Obviously, if the source of the trauma is a important caretaker for whom the trust has been violated, that's a more serious trauma, right? ADHD and addiction, you're asking here. I would say that 85% of people with addiction have ADD or ADHD. It's almost a marker, which is why I have grave concerns. And of course, I deal with people with trauma. Trauma also is associated with ADD and ADHD, but it's why I have very serious concerns about using psychostimulants like Adderall in people with the addictive disease. Ms. Producer, I hear you wanting to make a comment.
Oh, no, I'm just trying to do something.
Okay, is what I'm saying making sense? Is it digestible?
To me?
Yes?
I'm
Preferably?
working on trying to find a banner, so I wasn't listening.
Okay. I am now in a jeans.
I apologize.
I am now in a jeans, Alicia says. I don't know what that means. I'm fascinated to know. Yeah, what about kratom? I've talked about it a million times. It's a weak opiate. Just think about that. Weak opiate. And if you're a drug addict, concerned. All right. Give me your questions here. Thoughts on pronouns when dealing with patients. Val, I'm not quite sure what you have in mind there, whether or not we should be encouraging certain pronouns for patients. I defer to the patients on their preferences, so I don't really get into that.
Do they give you their preferences?
Sometimes they do, and I would consider it. Oh, your mom's house, the jeans. I get it. It would be, I think, problematic for the patient if I disregarded or disrespected their wishes on any manifestation of how they want to be perceived or see themselves. So, what's a good opiate alternative for pain? Toradol, Neurontin. Again, you have to get some real clarity on what's the component of pain you're struggling with. There's different regions of the brain that register different kinds of phenomenon associated with pain. There's the somatic component. There's a wound out here and it hurts. There's the misery component, which is the insular cortex, which this is horrifying. This is terrible. I'm miserable from it. Misery, somatic pain are different things, and they have different kinds of treatment. So what if the trauma is from a medical professional? Yeah, no good. No bueno. That makes it even more difficult to gain trust with professionals, right? Have I specialized in neurology? I'm an internist, so I had lots of neurology training. Do you have a specific neurology question? I've had lots of neurology training. And I think I've often said I would go back and do oncology if I were to retrain today, but neurology was the other thing I might do. I always loved neurology, and so I sort of came out of neuroscience. That was sort of my biology. I was a biologist with specialization in neuroscience, and so I've always had the fascination with the brain and the autonomic nervous system. Okay.
Let's plug your show again. I found the banner. Okay, so somebody said DrDrewTV.tv with a question mark.
Yeah, so you sign up there, and we'll give you a blast on Sunday afternoon where we do a more extensive version of this show, which includes live call-ins. Often I have guests as well, so check out. If you want to see a version of it, you can see me and Jason Ellis. It's up as it's on YouTube and everywhere, podcast.
Yes, it went up in podcast form today. So if you like listening in your car, you can go to Ask Dr. Drew on iTunes and listen to it in your car.
Okay, and then we have the other podcast at drdrew.com.
This is an old banner. I'm going to get a new one. Ginger Gonzaga was one of our guests as well. But if you want to skip the line, you can text your question to 984-2-Dr. That's 237-3739. And you'll get to be one of the first people to be on the show on Sunday. But make your question concise. You know, we would prefer not to have an entire book written there. Just, basically what you want to know. And
yeah, to get to the question. We can talk about the history when you call in.
But we want your questions in advance, and then you'll get a text when we go live.
And we love doing that show. And again, we're going to try to do these every day, typically midday, but we may do some evening shows as well.
Yeah, don't look at November 10th. I had to pull an old banner up. I wasn't very well prepared today.
And Bellick, Barb? Yeah, think more. She's saying neurology explains so much. When I spoke about regulation, I thought of the reptilian brain. Reptilian brain is an old concept, of course, and yes, these ideas from neuroscience are things that fascinate me greatly. There's a great book now called How You Feel, I think it's titled, which goes into great detail about the spinothalamic tract and how it feeds into the insular cortex and the structure of the insular cortex. I mean, I think a lot of people know that we have a homunculus on our cortical structures here, both for sensory and for motor in the parietal region of the brain. In other words, our motor function is dictated by these little strips in our brain where every part of our body is represented on the surface of the brain. Well, it turns out in the insular cortex in this region and through here, this sort of almond-shaped thing, we have a similar homunculus, but it sort of goes from anterior to posterior, front to back, or back to front. And the homunculus is repeated many times, and it goes from sort of a vague sense of the body to a very discrete map of the body. And if you think about bodily-based feelings, that kind of rings true, doesn't it? Okay.
Esme said something nice.
Oh, hi, Esme. Thank you. Esme's always great.
Missed you on terrestrial radio, but I'm excited for the next chapter.
Thanks,
you
Esme.
don't need no mainstream media. Thank you, Esmeralda. I like it. He does. He will. But, this is fun.
Miha, you can quote me if you get exactly what I said from this podcast. Like, really, really transcribe it. Yes, thank you. With the adult coloring books were all the rage back in the day. Yeah, adult coloring. I was very worried about our reading public back in about 2016 when adult coloring books were by orders of magnitude the most successful group of publications. Very concerning. Ketamine-induced therapy for trauma. Alicia, I don't know about ketamine therapy for trauma so much as ketamine for depression, and I do know it's shown really great promise there in recalcitrant depressions. I don't know about it in trauma. We are on Sunday going to get into a bit about hallucinogens and trauma generally.
We're looking for an expert. Everybody's busy.
Yeah, please.
Don't promote it yet till I get my expert.
All right, well, if you guys know anybody that's an expert in treatment of trauma and hallucinogenics and
we're working on it. It'll probably come through. We have to manifest it. It'll come through.
Okay. Peripheral neuropathy on gabapentin. It's an excellent treatment for it. Somebody else was asking about Lyrica and gabapentin abuse. Lyrica is more likely to be abused than gabapentin. Lyrica is highly sedating. I'm not a fan of that medication particularly, though in non-addicted patients with pain syndromes, it can be very helpful. I'm just concerned about that one. I've seen patients abuse it. Gabapentin, I've seen people abuse that too. In very high doses, it activates the same, similar, if not the actual chemistry in the chloride receptor of the neurons that's associated with the benzodiazepine class, like Valium and Xanax and those drugs. So people can use enough to give it sort of a benzo-like quality, and then, of course, they'll start abusing it. So both are things that need to be carefully managed. In lower dose, and by lower dose, I mean like 1,800 milligrams a day, I don't have a problem with Neurontin. I think it'd be very useful, particularly with post-acute withdrawal, things like that. Lyrica for fibromyalgia. Yeah, so fibromyalgia is a syndrome, right? It's not a diagnosis, it's a syndrome, and probably caused by many, many different things. But one of the most common phenomenon I see in fibromyalgia is a sleep disturbance. And some people, the sleep disturbance is because of the fibromyalgia. Some people, the sleep disturbance is pre-existing. In either case, if you improve sleep hygiene, the fibromyalgia improves. I've seen this over and over again. I'm convinced it's a major component of the fibromyalgia syndrome, whether it's causational or central. I don't know. All I know is that if you improve the sleep, you improve the pain. So work on maybe getting a formal sleep study and getting somebody who really knows how to use medication for helping sleep without getting you addicted to stuff and making your sleep worse, and really look into sleep as a primary area of intervention. So I've been going about 25 minutes, Miss Producer. How are we doing here?
It's up to you.
Well, I'm watching. Lyrica 225 milligrams. That's a lot, Mary. That's a lot. So be careful. That's when we start getting, and it's certainly sedating at those doses. But if you take it at night, maybe it would help you with that sleep problem. Again, I would not object if you are not an addict with no history of addiction and no family history of addiction, and you're on a large dose of Lyrica at bedtime with your fibromyalgia, and it helps you sleep. that could be an effective intervention. That
Talk
makes
to your
sense to me.
doctor, though.
Yeah, these are nothing I'm saying on any of these daytime daily doses are substitute for proper medical care. You always go back to your primary caretaker or your specialist, depending on what you're being.
And say, hey, Dr. Drew said.
I heard this was being discussed. This is an educational forum. This is not a prescriptive forum. This is not a substitute for medical care by any stretch.
Just double check with your doctor.
Yeah. Okay, I think we're sort of wrapping up.
This is your lunch bunch.
This is my lunch bunch?
Yeah, so I guess also Europe can see this if, we're...
So that's dinner time in Europe, or after dinner.
Yeah.
I better call Bert back. You're right. It must be super important because he knows I do this in the middle of the day. Usually he will text me back something like LOL. So we'll see if he does
also, if any of my fans are out there, which I doubt,
Oh, yeah.
but just in case, I'm producing a new episode of Calling Out with Susan Pinsky, and it's more of a spiritual show where I work with highly qualified psychic mediums to answer your questions tonight at 6 p.m. Pacific Standard Time. That's 9 p.m. Eastern, and we'll be taking your calls and contacting your loved ones.
This will be a call-in show tonight.
Yeah, I don't really have a topic tonight because it was very last minute. We decided to do it because Cindy Keza, the woman in the middle, is in town, and she's well known on the Travel Channel on the Holzer Files, if anybody watches that. But Psychic Rebel Colby will be here. They're both amazing, and they can help you with whatever you want to talk about.
Peggy says that Scott Adams spoke about mushrooms for quitting smoking. I have no doubt that psilocybin will have lots of use for a lot of different things. We ain't there yet with the science, so be careful. Be super careful. Okay, so is it me or does Drew read people almost as much as he can gather info based on their medical info? I'm not quite sure what that means.
Like a psychic? He is a little psychic. He's very intuitive. He just
but that's the job, right? I mean, a lot of I deal with drug addicts all day. Historically I have, and what they're saying is nothing. It's meaningless. They're just their disease is speaking. My job is to figure out what's really going on for the individual, and that requires a lot of intuitive kinds of thinking about what the person's experiencing, and then reflecting that back to them in ways that is not threatening. It's a very interesting thing to
Oh, and I forgot to say where my show's going to be. Can I do that really quick?
Yeah, go ahead.
So it's not going to be here on Periscope. It's on Dr. Drew's Periscope, but it will be on the Facebook, Dr. Drew Facebook, and also my Periscope, which is at First Lady of Love. That's with an FIRST. And also on my Facebook, which is facebook.com/Susan Seiler Pinsky, which is spelled like sailor with an E. So check it out. I don't know if anybody follows me, but I'm gonna try to get it out there.
Two quick things. Elizabeth, why do you hear Adam screaming? What would he be screaming about? And Sarah, addiction is a genetic disorder. Trauma can activate it. She's saying that the addiction goes to trauma. And when you have the addictive biology, particularly when it's a significant genetic burden and real heavy childhood trauma, you're going to get severe addiction, for sure. And so what I always say is, if you have bad enough addiction that you need to see me, I specialize in the way worst cases. If you need to see me, 100% probability of childhood trauma. I was giving a lecture one time, and I was telling that to a very fine colleague of mine. He goes, "Oh, don't say always. Don't say 100%. Don't do that." And I go, "Okay." So I got up at the podium. I said, "Well, Dr. S told me that I shouldn't say that my patients always have childhood trauma, so let me please reframe that. 100% of the time, my patients have childhood trauma." And that's just simply the way it is if the addiction is bad enough. But there's spectrums of addiction, right? There's incipient, there's mild, there's relapsing recurrent, there's all kinds of stuff. My stuff is the really severe strung-out drug addict. Trauma is always there in that case. In New Zealand, Sarah, your doctor doesn't listen to me. I'm sorry for that. And Elizabeth, psychics. Oh, that's why Adam's screaming. Yeah, Susan, Adam would be screaming at that. I agree with that. What is this about?
Wait, he's the one that produced my show the first time, right? Like, he's the one that came up with the idea. He's not. He hates.
Wait,
he hates
Jesse
psychics.
wants to know about me and Russell Brand. What can you say about that?
Oh, what about him? He's doing a seminar on February 7th. We're going to probably be posting it all over drdrew.com. He's going to be coming on the Ask Dr. Drew show.
Call-in show.
He's been on our podcast. He was on This Life You Live a year and a half or 2 years ago, and
He was?
Yes.
Oh, that's right. He came in. That's right. Yeah.
Yeah.
Yep,
So, anyways, they reached out to me and wanted to know if he could do your show or something, and I was like, yeah. And he picked 2 shows to do, 2 podcasts. So he's going to be coming here at some point in January to do a podcast, Ask Dr. Drew, coming up, and then you're going to introduce him at his forum, which I wish I had that off the top of my head.
We'll get it.
But I stay tuned. You'll be sure to know it's coming because I'm going to make sure of it.
All right. When am I coming to Europe, Maria? Bring me out. I'm delighted to come out. If somebody has some place where they want me to speak or can, some sort of whatever you'd like, I would love to do more speaking in Europe. Yeah, Susan?
Switzerland would work for me.
Well, this is Bellamy is a Switzerland.
We have somebody from Switzerland. She's on Twitch too.
Bellamy is?
No. Yeah, Bellamy.
Yeah.
She says, I'm Rito from Switzerland.
She's had success with Subutex.
Yes.
I understand. Be careful. Bellamy. Addiction. There's many different ways to treat that, and it's not just one size fits all. So, I'm glad that worked for you. That's excellent. Something is going on Periscope. We're hearing from somebody. Trichotillomania in adulthood. I can't grow a beard without pulling the hair out. That is trichotillomania. And trichotillomania is a difficult disorder to treat. People have tried to treat it with cognitive behavioral therapies and with pharmacotherapies. I will tell you that when they do treat it, it is high doses of serotonin reuptake inhibitors are required, and so all the side effects come with that, and it is not that effective. Hi, Chris. That means a lot to me. I appreciate that. I won't divulge all that, but I'm glad you're well now. So, yeah, trichotillomania is difficult to treat, and most people kind of live with it and learn to manage balance the behaviors a little bit, but they don't expect them to go away completely. It sort of remains as a mild, low-level chronic condition oftentimes. All right, Ms. Producer, can we wrap this thing up here? Jewel has a question before we do. Post-traumatic stress disorder from trauma and borderline personality disorder. Yes, all true. I did not talk about post-traumatic stress disorder as it pertains to trauma in my little spiel about trauma, and both acute and chronic PTSD do occur from traumas of various types, of course, and those traumas can, if they're in certain periods of childhood, and again, and get in the way of certain relationships, can figure into our personality development, for sure. And the personality issues kind of stay even when you treat the traumatic dysregulation, but the manifestations of our personality structure can be sort of diminished when emotions are regulated better. Thank you, guys. We appreciate you being here. We appreciate being part of this. We'll try to be here every day, as I've said repeatedly. Do a few minutes of this daily dose, and sometimes in the evenings. I have a feeling we're going to be later in the day on Fridays. Today's Tuesday? No, Wednesday. Tomorrow, I think we'll be in our usual time. Let me double check you on that.
Well, we don't know yet. We're gonna play with this and see what times work. Some people can't listen at noon.
Tomorrow I can't do the evening, but Friday I can. So maybe we'll do a Friday evening, and we'll see what's going on. And if we do evenings, that closes out Europe. We can't talk to those folks because it'll be middle of the night there.
Thank you, Monique, for saying that you like us both talking, because I'm not great at speaking, but I like to talk.
All right, everybody. Hi, Colleen. Met you at MSU backstage. Thank you for that. That was a while ago, right? Monique, have a great day. We appreciate all the well wishes here, and I will see you next time.